couple of general things that, I couldn't put them in a category. One are my loops. I use oroscopic. You've seen them probably in my videos or my photos. I'm on my second pair and only, 6 years. And the other pair still works really great. My eyes kind of changed a little bit and I just wanted to have a backup pair. One of the things I really love, of course, about the oroscopic loops is that there's no battery pack. They're completely cordless. And yes, there's these little batteries that go in an additional area behind your ear. But I am against battery packs. I don't want to be caught with a cord. I used to actually be walking by a door and for somehow the wire would like jump into the doorknob and pull me back like I was on some sort of skit. So I didn't like that and I just wanted it to be just one thing. So anyway, that's the main other reason why I love it, besides that they look good. Welcome to the Truth About Dentistry podcast. I am Dr. Peggy Bound, a successful solo dental practice owner in St. John, New Brunswick. After years of figuring out how I wanted to practice, I now run a fully digital clinic providing my own brand of dentistry on my own terms. It wasn't easy and I'm still learning, but I know I have so much knowledge to share. This podcast is created to help inspire young dentists or anyone looking to transition to a more digital practice. I aim to give you actionable step-by-step strategies to help you navigate the modern dentistry landscape. If you're looking to become more digital, improve your skills, or even have a more profitable practice, then this podcast is for you. Now let's get started. Hello, welcome back. I am excited today. Well, it's a beautiful sunny Friday and Quincy and I are getting to batch podcast episodes all day, so it's always fun. So I'm just in a great mood and I thought, you know what, let's talk about my favorite products because sometimes, when you're using something over and over, like it's something that maybe one of you can really benefit from and you're really struggling, or you'd like to try a new product in this particular area of dentistry. So we're going to go over, I don't know how many, I just grabbed my favorite products and I looked through my drawers. I'm like, what are my favorite things that I love? So I'm going to be sharing that with you. And and I'd love to hear from you. If there's something that you love, make sure you DM me on Instagram or you post it and tag me. So let's get started. Now, the first, I'm going to sort of break it into different areas. And as you know, I do a lot of cosmetic dentistry and I love to, I've really explored. I'm always willing to explore. So if there's something that you think, again, that I should be using, please send me a message. But I have really taken a lot of courses and learned a lot about some really good products in the last few years that I think make the whole cosmetic dentistry, direct resin restoration process a little easier. So let's start with those. Before we even do the composite resins or we're doing a mock-up of some sort, and we talked about this in another episode, but if we're doing a mock-up, of course, we're going to use a Bisacryl for that if it's an indirect mock-up. But if it's a direct mock-up, my favorite two flowable resins, and I'll use flowable for those, and those are Luxaflow by DMG. I don't know what it is, but it just holds. It doesn't run. It looks very good. The shade is good. It looks really great. And then the other one that I really love is Tetric EvaFlow. And I believe in both of them, the shade is like bleach or whatever, white, like not a B1. It's just a more bleach shade, but they do have different shades. So you can explore with that. So that's Luxaflow by DMG and the Tetric EvaFlow by Ivoclar. So as far as the actual composite, I use a lot of different ones. Okay. So I've used several. I'm going to tell you probably the ones that I end up using the most, right? Like that's what you probably want to know. And the two that I use the most, now it depends on the technique, but if I'm going to be doing like multiple units and it's freehand, it's not direct flowable and it's not BioClear, then I'm going to probably use Empress Direct by Ivoclar. And of course it comes in so many shades. Putting the BLXL Dentin with the BLXL enamel is crazy white. So I'll often do B1 Dentin and I'll do BLXL enamel. That tends to look really beautiful and I'll put like a translucent color on top. The next one that I tend to use is Cosmodent, and that's it's called Renamel. And I learned, again, Dr. Hansen, Marshall Hansen uses a lot of Cosmodent, or uses Renamel by Cosmodent. And we find the SB3 is a really good one. And of course, there's so many variations in that. And I'm just working with those now, but I'm really enjoying those as well. And again, layering, dentin, and heating the composite as well. So I'll also, no matter, even if I'm not doing BioClear, which we'll talk about in a second, I'm heating the composite so that it really flows. I'm not having to add in a lot of, I'm not using as much material, first of all. And I'm also not using as much unfilled resin, which I'll talk about that in a second. Now, if it's direct flowable technique, which is like a DSD direct or direct flowable technique where we actually injecting the flowable into a Siltec or an Essex template, then that is going to be probably one of my favorite shades is, two of my favorite shades. One is by Voco and it's Grandioso, and we use BL. It's a lovely shade. It works really well. It's got some opacity to it. Now, if you want less opacity and your injectable, your teeth are in a perfect place, they have a nice base color, you can certainly go with, again, the direct with flowable by Ivoclar. So that would be, again, you'd use BLXL or you might use B1. And then the last technique would be if I'm using BioClear, right? So if I'm doing BioClear, then I'm going to use, which is another one of my favorite things, that's also a heated approach. And we're going to use the BioClear matrices, but we're going to use Evanesce, and we're going to use the matching flowable that goes with that. So that's how I got into those. And again, they're going to be heated. I may use the compules but I'm definitely going to use the flowable for that because I want everything to match up. And that works really well, but it's very situation based. So I will not do BioClear on all my cases. I will not set up my Invisalign cases just for, making the teeth bigger. I will only use it when I'm really trying to close a large black triangle or I'm actually trying to close diastemas. And they actually have matrices now for the posterior too. And so we're working with that, and that's been really, really nice. You can jump some crazy distances in a really safe way that doesn't cause, any problems with the tissue. So that's BioClear. And one other really cool composite, and it's come up in some group chats that I've been in, is people are looking for pink flowable resin. And of course, it's up by the gum line, or I've even relined a partial that was just like a very thin, it was in an aesthetic zone. You can add it to, porcelain, or you can sort of help make it fade away as far as like your finish line. But it's really good, and it's called NX Gum. Now, Christian Coachman, I believe, had a kind of a hand in this. My favorite color is orange pink. It comes in other colors like pink translucent and all these, but the orange pink by Annex Gum, or by Annex Gum by Christian Coachman, I think it's called, is the very best. It's really good to have that in your toolkit. Other little things like you can get from, I believe, Cosmodent, are like the violet colors and things like that for putting translucency and things like that into your incisal edges. And so you really want to be able to have a few extra tools in your toolkit to block things out. Oh, and then last one is the pink opaquer, and that's also by Cosmodent, and that helps you like mask a really dark tooth or dark staining underneath your restorations, or even a metal core.
Do you want to become the modern dentist in your area? Our on-demand and live mentorship will help you stand out, attract your ideal patients, and build a niche-based practice. This A to Z training is for dentists and team who desire the digital workflows and skills to operate a thriving digital practice, helping you stand out in a crowded market. This course is the culmination of Dr. Bound's 20-plus years of experience in building a patient experience that patients will pay more for. Learn from our on-demand courses or receive a more customized experience with our mentorship program as we guide you through the curriculum. You can find out more from the link in the show notes. Or, if you aren't quite ready to take the plunge, you can also find the link to our freebie consult photography guide, which will help you get the right shot on the first attempt. Now back to the episode.
So now once I'm working with the materials, once I'm working with the materials, I will use different tools. So the couple of the tools that I absolutely love that couldn't do a case without, let's say. One would be the Optrasculpt by Ivoclar. And that's a gray tool. I think I just already mentioned it, but it's got a little white pad. They also comes in, there's other little tips you can get, and that can really like create cusps, and it's got a little bevel to the, to the tip, and it's totally different than the circular one. But all in all, like I'll use that for both, for all my case, anything I'm doing. But the Optrasculpt will not do a case without Optrasculpt now. And I actually discovered it on Instagram. I didn't learn about it in a course. And another one is it's a gold tool. We call it the beaver tail. I learned it with one Danielle LaRosa's course, and she uses that. It's called the gold instrument, and there's a couple, like a really fine paddle, almost looks like a beaver's tail sort of on one end, and then the other end kind of pushes it. So that's a great one. It's a very delicate instrument, and that's through clinician's choice. Now, when I'm working with the material, if I do need to wet my instrument, I'm going to use unfilled resin by Cosmodent. Again, wouldn't leave home without it. And a couple other things that I wouldn't leave home without actually is sort of funny. And I joke about this all the time because I'm usually like wearing a necklace or something like that. And they're called quick strips. And we, of course, started using them with Invisalign when we were doing IPR. But the white one, the basic one, doesn't actually have a grit on either side. That allows me to break contacts. I'll use that when I'm delivering other porcelain veneers and things like that. And it's got a little like hole at the top. So I always joke that I'm going to like put it on a necklace someday and just wear it because everybody needs a contact breaker in their life, right? The other thing that I really love are, I think I already mentioned maybe ASCP discs, the purple and the pink. They absolutely bring your composites to an incredible shine without all the other fancy work. If you just wanted to polish up someone's veneers or composite veneers, you're definitely going to use that. And then an enhanced cup, many of us have been using those for years. So it kind of, that's probably not one that you haven't heard of, but the enhanced cup is also, incredible for the posterior teeth. Now, if I'm doing porcelain, of course, I'm going to be packing cord. I'm going to use the knit pack cord, and I use 000. It's a green, and it's the nicest cord I've ever seen. So it just doesn't fray. If you've got to pull it up from a deep space, it never kind of breaks. It's really, really good. Another thing is the NX3 by Kerr, and that is actually, I learned that from Appa. I think that's one of the cements or luting agents he uses for his veneers, and it's so incredible. It holds everything. You don't need a lot of it, and it just things stay where you put them. There's not a lot of spring back or just sort of not a little pushback, but you don't need a lot. But it's amazing, and the shade is you don't need like a million different shades. A couple of general things that I couldn't put them in a category. One are my loops. I use oroscoptic. You've seen them probably in my videos or my photos. I'm on my second pair and only, 6 years. And the other pair still works really great. My eyes kind of changed a little bit, and I just wanted to have a backup pair. But I love those. I think they're the most comfortable. They are usually, if you have a very small head, doesn't work super well. But I think they just came out actually with a line for hygienists, and a lot of hygienists are female. So I think that they're probably realizing the demand for something that's a little less wide. But I got them when I, started in 2015 with this new clinic, and I just love them. One of the things I really love, of course, about the oroscoptic loops is that there's no battery pack. They're completely cordless, and yes, there's these little batteries that go in a additional area behind your ear, but I am against battery packs. I don't want to be caught with a cord. I used to actually be walking by a door, and for somehow the wire would like jump into the doorknob and pulled me back like I was on some sort of skit. So I didn't like that, and I just wanted it to be just one thing. So anyway, that's the main other reason why I love it, besides that they look good. So when we're doing our Optragate, and that is also an Ivoclar product, I love Optragate. It can slip out around the cheeks, so we always put triangles like on either side, and we found some triangles really cut. So if you're putting the Optragate on top of it, then the triangle corners will pinch, and they can also get really full, and they can break, and then that material gets in the patient's mouth, so it's insane. But what we found is that the parotid ones by Parotid are those triangles. They're super soft. I mean, they're like, oh my gosh, they're like a they're cotton almost. And they also do a great job absorbing, and they don't tend to break as quickly. So big, that's one of our newest finds that we're really excited about. We get them from the surgical room, but I think you can get them anywhere. They're called dry dent parotid. Okay, so my assistant's going to laugh. She's like, where are all the things? Because I took them all out to do this podcast episode. But I really want you to just know some of my favorite products that I use, and hopefully that this can help you too. And like I said, share with me if there's something you absolutely love, and I will talk to you next week. Thank you so much for listening. I really appreciate you taking the time out of your busy day to listen to this podcast. And again, hopefully I inspired you in some way. If you feel that this was helpful, or you have any colleagues that you think would really maybe enjoy some of the content like this, we're going to be here every week. And I would so appreciate it if you would subscribe to my channel and also share this little discovery of this new podcast with your friends and colleagues. If you do want to reach me, you can certainly find me through my social media channels, Dr. Peggy Bound or Peggy Bound Dentistry, or you can reach me on my email, peggy@smilesbybound.com.